Here we go. Good afternoon, everyone. We'll get started in just a minute. I'm just going to let our viewing audience join today's town hall. We'll start with a little housekeeping and then get right to it. Try and get everybody back to your busy workday as quickly as possible. Usually like to see our participation just kind of break over the 100, 200 mark. We'll see. I know a lot of people also tune in after the fact online. I would expect to see a pretty good turnout today. It's been a very, very busy, compressed week for everyone. Hopefully we'll have not have too much intense capacity pressure upon us this long weekend, but we'll talk a little bit about that in a moment. Okay, so we're getting about 150. I'm going to suggest we get rolling. Everybody's got a really packed day, so we've got some great presentations on our operations and on our Project Odyssey progress today, as well as celebrations. Bit of housekeeping off the top. We do have the Q&A function on today, so you can ask questions at any time during the town hall. You just pose those using the Q&A function, please, not the chat function. We'll keep the chat function for our celebrations at the end. And as those questions are answered by our presenters, you'll see those answers stack up in the answered tab. So you can ask a question, then view the answer in the answered tab as we go. And please think about any shout outs or celebrations you might have. We'll leave time, as is our custom at the end of today's town hall, to have celebrations, something that you want to recognize. That's your time. You can type it in or shout it out live. Today, our president and CEO, Rob McIsaac, had a conflict, but we're really pleased to have Sharon Pearson today to be moderating, kicking things off, our EVP Clinical Operations and Chief Operating Officer and Chief Nursing Executive. So Sharon, over to you.
Great, thank you, Aaron, and good day, everyone. Happy to be here for Rob. We'll start as we always do. We are privileged to provide care on the lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. So today we do have a fairly light agenda. As you can see, I'll have a bit of an operational update for everyone. And then of course, Epic update, and then some time for our celebrations. But we will keep it light, and we don't want to keep folks away from your work too long. And as Aaron said, it is a compressed week that we have. But I would like to take a moment to acknowledge that today marks the end of two very important observances, Pride Month and National Indigenous History Month. So a month of celebrations. And I know that many of our teams have taken time to acknowledge and celebrate during these last 30 days amongst themselves at home and with patients and families too. And, you know, to illustrate this, I heard a great story about the Allied Health and the Spiritual Care team on E3 at the Juravinski site. And the team had been working so hard to help a patient reach their rehabilitation goals. And one of those goals included being able to get from a bed to a chair so they could leave their room. And then just in time for National Indigenous Peoples Day, which was June 21st, and this newfound freedom the patient had in that they could leave their room, the team was able to coordinate a smudging ceremony in honor of the patient's culture and spiritual beliefs. And other team members were invited to participate. And from what I heard, it was described as a really emotional experience for everyone involved. And, you know, really can't think of a better example of patient-centered care, which, you know, we have been committed to. And this is such a poignant reminder of the role each and every one of us play in actively supporting equity and diversity and inclusion in our hospitals every day that we're here together. So, you know, it's a wonderful reminder, and it's a reminder that our care is holistic, and it's much more than just the technology and the interventions that we spend a lot of our time on. So thanks to the E3 team for creating such a compassionate and inclusive experience for our patients. And it was, you know, just outstanding to hear that story. So thank you for that. And with that, I'll just move on to a quick update in terms of where we're at. It seems like a while since I updated on the COVID numbers, but today we sit at 35 COVID patients, less than 5 in ICU. We have seen a bit of a pickup in our outbreaks. So we have 3 outbreaks. And we've also seen a bit of a pickup in the number of our staff in self-isolation, which we're at 131 today. If we go to the next slide, in terms of how our sites are doing, the pressures sadly have not subsided. So we continue to struggle with very high occupancy rates. So you can see our aggregate rate at midnight at pretty much 99%. Our adult occupancy lower than that, but that is where we need it to be, lower than that. And then, of course, at a discrete site level, all of the sites have been extremely pressured. I would call out some inordinate volumes that we're seeing in the ED departments, inordinate acuity that we're experiencing as well within those departments as well. Certainly, McMaster Children's has seen a significant increase in the volumes within their ED department, and you know that's reflected across the province as well. And our ALC occupancy sitting typically where it does, very close to that 200 mark. If we go on to the next slide, just a few other highlights. I think the last time we spoke, we might have been approaching 80% of our pre-COVID surgical activity. Unfortunately, that has slid back a bit to about 75% again, due to pressures that we've had with occupancy and staffing as well. And then those widespread system pressures, you know, there's lots in the media around this. It's certainly not isolated to HHS or Hamilton. It's very broad across the province and country that we're seeing these sustained pressures within EDs, within the ICUs, and certainly in that children's population. Our trauma volumes have increased this year, so that program has been extremely busy and over capacity, as well as our NICU pressures that have been sustained, and we have made some amendments to bed capacity in order to recognize those pressures. We have pressures within our stem cell program, and those pressures are felt across the province as well. In terms of some mitigating strategies, certainly we continue our planning, and I had mentioned previously we have funding for an approval for the next 30 beds at the satellite, so we're working on getting those beds opened and staffed again to address those ALC pressures that we have. And as I've referenced before, lots of planning going across the HNHPB, Lynn, with our partners in order to support some of the struggles they're having, and also to work collectively towards solutions to these pressures. So lots underway that many of you may not see, but a lot of work trying to relieve the pressures on our staff and on our organization. So just a bit of a brief update, but I'll hand it then back to Aaron.
Yeah, thanks very much, Sharon. For sure, a lot going on. Thank you for the update. Next up on our agenda, we have Dr. Barry Lum, who's our executive lead for Project Odyssey, here to tell us where we are in that journey. What is it now, Barry, like week 3 after go live? They all seem to blur, but I know we're making incredible progress.
Thanks, Aaron. It's actually 27 days since we went live. 1 month ago today, we were deep into the inpatient cutover activity. Heart rates were high, stress level was high, and here we are now, almost a month in, and you know, as people have heard me say over and over again, and I'll never stop saying how much we have accomplished in combination with our staff and our Odyssey analysts and staff to get to where we are. So just on behalf of the team, thanks to everybody. Next slide, please, and thank you. Okay, we're slightly out of sequence, so I'll go with this. This slide shows just some of the items that have been accomplished as we've been through this over 2-year journey now to get to be an Epic hospital and be truly into the electronic health record world. I just highlight a couple. Some of you will know about something called Secure Chat, which is the equivalent of a messaging app that's entirely secure within the Epic environment and allows providers and non-providers to communicate with each other. It's taken off. We're very pleased with how well that's going and how it's allowing teams to work more effectively between the various practitioners. We've got now, and I'll show you just a little bit more about MyChart registrations. It's also taking off. We're well ahead of where I thought we would be in terms of MyChart, and it's growing quite quickly. And one of the items I like to highlight is the 35,000 records shared. And what this reflects is the interoperability capability of the Epic environment so that we can share back and forth between our other EPIC partners across the province, and indeed actually internationally. And we've actually had one of these already, so that what happens at St. Joe's or Trillium or UHN or Sick Kids Ottawa all can be shared back and forth between EPIC organizations. Next slide, please. So where are we today? The ticket volume started very high as we expected, and it has come down nicely into an average now of about 700 a day. That sounds like a lot, but the team is really making very good progress on closing tickets and moving forward. And one of the things that we now are coming to learn as we begin the stabilization process is that tickets aren't the be all and the end all. And, you know, as the issues move from quick fixes to complex issues that need to be addressed, we're beginning to understand and take advantage of the opportunity for our analysts to get out into the field, get to the units and actually sit with people and really understand their issues. What does that mean? Well, it's always received extremely well, but it also means that they're out of the office, and so their ability to close tickets may be slightly slower. But when it's all said and done, a number of tickets will be able to be closed as a result of that visit to a clinical area. So we feel that this is a really important next step as we move through our stabilization. Many of the areas are working very well. I'm not for 1 minute wanting to imply that it's perfect. It's not. That's why we call this stabilization, and it's going to take many days and weeks to before people are truly fully comfortable in the environment. You'll all be aware that we have these floor supports we call our at the elbow and super users. Our plan has always been to begin to wean us off the external support, and I'll spend a little bit more time talking about that in a moment. But as expected and as planned, we will be gradually weaning down our at the elbow and super user supports over these next 4 weeks. We are very aware that there are areas that are having more significant problems than we would have hoped. This includes the chemo suite at the JERV, some of the pediatric clinics at MAC. Our DI colleagues are struggling under an immense volume of referrals that need to be dealt with. You heard me talk about the MyChart registration, and I will tell you that this has been so brisk that we're bringing in extra resources that will be starting literally today to help get us through a backlog of the MyChart requests. Next slide, please. So just a little bit more about supports. You'll all be familiar with the blue and the yellow vests. The blue vests, of course, represent a combination of our own super users together with external folks who we have brought in, and then our yellow vests are all external individuals to HHS, but who are very experienced on the provider side. Sharon has mentioned that the clinical burden of work and severe staff shortages are continuing to place an immense strain on those who are at the coalface providing care. So we are going to begin to accelerate the rate at which our own internal super users will move back into their clinical world. We are able to backfill some of this with external at the elbow support, and I think we're now getting more and more comfortable with the fact that teams are now functioning as teams, not just in terms of their clinical care, but their ability to operate in the EPIC environment. And so as the super users move back, we're hopeful, and we think based on a survey we did this week, that many units feel that they're developing more than just one super user, and they can lean on each other to provide a lot of that support. That being said, we always have the 43,000 number, and we would really encourage you to take advantage of the virtual at the elbow support, which will become more and more important over these weeks as we begin to wind down the on-site supports. The overwhelming sentiment has been that this has been an extremely successful endeavor. None of them are perfect, and some have been better than others. And I would say that the team has been very good at trying to find individuals who are doing their very best and to take advantage of them. Next slide, please. So just some stuff that's happened, and many of you may know Blake Yaroskovich, who is a pediatric neurosurgeon. There's a really neat piece of functionality within the MyChart environment that allows family members who are part of that MyChart to be updated as a patient moves through their phases of care in the OR, and they did this week, and we got a very positive feedback about that. Lots of other good stuff happening. I won't go through this lesson in great detail, other than to say voice recognition in the Haiku and Canto environment, as well as in hyperspace, is a big hit. The ability to upload ECGs directly into system and to be able to have access to them easily instead of hunting around the wards has been a big hit. Omnicell is now well established and not in a critical override situation. And of course, our ability to provide prescription output for our partners is also very important. Next slide, please. So just a few reminders. Please keep in mind how you need to and want to reach out for support. And on the patient flow issue in particular, this was a difficult piece of work in the early days, and we now have established a rapid escalation process should people be finding it's difficult to move patients through the system, and especially to get them admitted from ambulatory areas, for example. So don't be shy to take advantage of that. Call 43,000, ask for go into number 1, and we will get you rapid support for your patient flow issues. We have restarted voice calls for appointment reminders after having to turn it off for a few days. That's now up and running. And we continue to work on this challenging piece of understanding the collegial relationship that needs to happen between physician and nurse in terms of the need for phone orders or verbal orders. And then I just spend one more moment just to talk about what stabilization means versus what optimization means. So stabilization needs to get us to a point where we can function on a day-to-day basis. It doesn't mean that we solve all the problems or that we don't have a long list of other things that we would like to accomplish. That's optimization. We keep a list of all of the tickets. We are well aware now with a long list of items for optimization. And so if you don't feel that your issue has been addressed during this stabilization phase, please don't think it's gone. It just won't be something that we can deal with on the very short haul. And as always, look for your tip sheets and any other resources on the hub. And I believe that is my last slide, Aaron.
Okay, well, thanks very much, Barry. So I'm stand corrected, not 3 weeks, it's been 4.
That was a lie, Aaron. I have to come back, and I apologize.
I'm now back with one more slide, Dr. Barry.
Yeah, you can't trust that guy. So the other thing is, you know, this has been a big change for us internally, but it's also a big change for our patients. And so we want as much as possible to help you be able to have conversations with your patients and explain what is going on. What the heck is that scanning device that you're using? You know, why am I wearing an armband that looks funny? What are all these mobile devices about? And how do you communicate with your patient when you've got a computer and a patient, and how you can develop skills that allow you to take advantage of the monitor rather than focus on the monitor. Take advantage of the monitor by engaging the patient in the work that you're doing. And sorry, now, Aaron, I truly have had my last slide.
Maybe there's an encore. No, that's it. Okay, so we have had the Q&A function open today, and a couple of questions have come in. Of course, if you think of a question after the fact, or perhaps didn't want to raise something specific here in this forum, you can always send your questions to hhsnews@hhsc.ca. That's our question inbox. So if you send something there, then we'll make sure to connect with the right person who will have the right information and get you an answer as quickly as possible. Okay, I think we're in. Next slide. Oh, yes. Okay, so we did have a generous offer to our workforce in celebration of, I guess, Canada Day and our hometown CFL team. 2 wonderful tickets for the Ticats, one of the games coming up. Not sure specifically which one, but oh, it says tomorrow's game there. Okay, perfect. So these are, I know, some of the best seats in the house. These are box seats in a climate controlled area. So you can sit back, relax, and watch the Ticats if you're not working. And that's a wonderful way to spend Canada Day for sure. I guess we thought one way we might be able to celebrate some of the progress we're making with our Epic installation is to have teams engage with our hashtags online through social media and share some of the stories about how your team or you individually are winning with Epic. Now, I'm not suggesting that there haven't been challenges. We're totally aware that there have been, but maybe even to focus on how teams are working together to overcome those barriers and the personal things that are happening to help you adjust. I know there's a lot of work that's gone on, but as Barry pointed out, there are some incredible wins too for our patients and families and for our organization. So sharing your stories is an important way of drawing a line of sight to that work. And if you do so, I think we'll randomly select amongst those stories that are shared online, someone to win these tickets to tomorrow's Ticats game. So thanks to the community that has provided those to us, and there'll be more. I'm sure we'll send something out again later today via email. So let everyone know, and if you have a chance, put something together and send it out, a chance to go to tomorrow's Ticats game. Okay, next slide. So we have celebrations. We can close with things that people would like to recognize, individuals you'd like to recognize, perhaps stories of wonderful things you've seen happening across our organization. I see Allison Fox Robichaud with a hand up. Let me just get to my participants area so we can allow her to give her shout out. Dr. Fox Robichaud, can you hear me? You can go ahead now.
Thank you, Aaron. Just remind everybody that this is the July 1st weekend, and while it's a celebration for Canada Day, it's also welcoming for a whole new group of PGY1 residents who are starting, some of whom are starting tomorrow morning, many of whom have been in their EPIC training already, new subspecialty trainees and new clinical fellows who are starting. So many of them, this is their first introduction to the Canadian healthcare system. So welcome to all of our new residents, medical residents and fellows starting.
Awesome. Thanks very much for reminding us of that. Great shout out. Kelly Campbell, I see you have a hand up. What would you like to celebrate today?
Yeah, thanks, Aaron. So a couple of months ago at a town hall, I indicated that Chuck Donahue, our Director of Facilities Management and Security Services, was retiring. And today is actually Chuck's last day. I suspect he's on the town hall, so his last town hall, and I just wanted to acknowledge Chuck for his years of service and support, literally 24/7 for the infrastructure of the organization. And certainly we're very excited for the next chapter of his life, which includes a lot of upcoming travel. So thanks to Chuck, and to welcome Alan Buxton as the incoming director replacing Chuck. So
Thanks, Kelly. And I guess while you and I are both sharing the screen, we could also give our best wishes to our colleague, Lorene Hodgins, who most recently was executive assistant to both Kelly and I. And after 32 years with Hamilton Health Sciences, Lorene is also taking on her much-earned retirement. So another retirement announcement, and Kelly and I have had the chance to thank her, but thanks again, Lorene, and happy retirement to you. I see also, you know what, there's another retirement here. I know Marcy Sachs-Braithwaite very early on put into the chat forum that she would like to thank Randy Calvert for all of his commitment and dedication to HHS after 31 years. So Randy, we wish you all the best in your retirement. We'll all miss you. We hope Elaine and you get lots of time to sail away and have a well-deserved rest. So another retirement shout out to Randy in addition to Chuck and Lorraine. So happy retirement. Okay, I've got to catch up here in my chat forum. I see that there's probably some other celebrations that have been streaming in from Susan Futurelli. Congratulations, Chuck, on your retirement and best wishes to you. Congrats to Chuck and Lorraine from Brittany Pierce. Congrats, Chuck and Lorraine from Anita Lamond. Deb Bedini, congratulations to Patty Arpino, manager in the HGH Hamilton General Hospital Emergency Department, on her retirement after 38 years today at Hamilton General Hospital. Her last day is today, and we wish her all the best. From Annette Lasabita, congratulations, Chuck and Lorraine, best wishes. From Julie Blaskevich, I'll also say happy retirement to Chuck Donahue, the best neighbor anyone could ask for. So there you go. Okay, we'll give another call for anyone that has a celebration to deliver live or in writing. I know sometimes it takes a minute to type them. All right, I'm not seeing anything come in. So Sharon, maybe we'll give last words over to you. Thanks, everyone.
Great, thanks, Aaron. And I too would like to extend a personal best wishes to Patty and Lorraine, who I have personally worked with for decades. So wish you both the best, and also wish Chuck you all the best too. So thanks everyone for joining today. And again, all the hard work this month. I know it has been a challenging month, but we have had great successes. So thanks for all of your efforts. We will be reducing the frequency of the town hall. So the next town hall for your calendar will be on July the 14th. Hope you can join us. I do hope people have the time to celebrate this weekend, Canada Day, wonderful day to celebrate. And I do hope that you all have some summer vacations in your schedules as well. So happy Canada Day, and see you the next time.